Oh, didn't see you there. Oh no, come in. Relax. I was just about to talk about an important subject. What do you know about health promotion? That's okay, don't worry. I'll give you a quick Soldier's 5. Health promotion is an underlying concept in the curriculum for health and physical education. This means that health promotion will support the framework when we teach our key areas of learning. In other words, health promotion will be implicitly taught to our students throughout their HPE experience. This is an important factor when considering health promotion because it is very difficult to teach someone to be healthy, but much easier to teach someone about health. This way students can make their own decisions about what they think health is, and then hopefully live a healthy life based on their circumstances. A key area of learning in the curriculum of health and physical education is food and nutrition. Food and nutrition education enables students to make informed decisions about food and the choices that will contribute to their own well-being and that of other people. This is an example of how health can be promoted through the curriculum. Health promotion, along with the other underlying concepts, are present in all other key areas of learning, highlighting one of the initiatives created by the World Health Organization that I will explain in detail shortly. Health promotion is a process that helps to create supportive physical and emotional environments in classrooms, whole schools, communities, and society. Historically, the responsibility of being healthy is placed on the individual, and if a person becomes unhealthy, the first reaction is to blame that person. For example, if we see an overweight person, we often assume that that person is unhealthy. This may or may not be true, but let's imagine that that person does have health issues related to obesity. More often than not, our first reaction is to think that that person is lazy and assume that if they were to exercise and eat healthy foods, then there wouldn't be an issue. What isn't considered is that this person cannot afford to go to the gym or afford expensive health foods. The person may also suffer from a disorder which makes them struggle to lose weight. The factors that are outside of their control could include their socioeconomic status, genetics, or access to training facilities. The movement towards taking some of the responsibility away from the individual and acknowledging that it is the responsibility of the state or even society reflects the foundations of the World Health Organization's Ottawa Charter, which involves many countries who share the same goal of making the world a healthier place. The Ottawa Charter for Health Promotion is an initiative created by the World Health Organization that hopes to improve the well-being of the world's population. The Charter states that the prerequisites for health are peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity. Now, if we think back to the scenario of the overweight person, we can already see that food, income, and even equity could all be potential barriers that are restricting this person from attaining health, according to the Ottawa Charter. In most developed countries, you would expect that a reasonable level of health should be attainable, however. The Ottawa Charter details 5 action means they think that if adopted and maintained will promote health and develop well-being. They are: build healthy public policy, create supportive environments, strengthen community action, develop personal skills, and reorient health services. Building a healthy public policy places responsibility on the governing bodies to ensure that the population is treated equitably regarding taxation, income, and the availability of healthcare. Creating a supportive environment means that we understand other people's strengths and weaknesses and show empathy, much like the scenario with the overweight person. It is also about looking after the environment and recognizing the impact that the environment has on well-being. Strengthening community action is about making the community aware of existing health issues and empowering them to make a difference. By using existing resources and strengthening public participation, we can create support services for those in need. Developing personal skills is an area that we as future teachers will have a lot of influence over. We will have the opportunity to give individuals knowledge about what health can be. This is influenced through our key areas of learning, as I alluded to earlier. We may be able to influence the other action means as well. Reorienting health services focuses on research and the ability to identify where the healthcare system needs to focus its attention. Now, I want to talk about a sensitive issue that I think is very relevant and important. Mental health. Mental health has been in the spotlight a lot lately, and a recent report shows that a third of deaths of those aged between 15 and 24 are a result of suicide, which is the highest in any OECD country, nearly twice that of Australia. This truly is a youth health issue that needs to be addressed, and I think that it can be positively influenced through some of the action means identified in the Ottawa Charter. Unfortunately, I have been affected by suicide at numerous points in my life. The first time I was very young, about 9 years old. My mother's friend, who was 24, jumped off the Grafton Bridge. This was before the barriers were in place, but as a result, they were erected. This is a practical application of how public policy can prevent suicide, but it is superficial. I was too young to understand back then, but as I look back and talk to Mum, I understand that she suffered from depression. The next time I was affected by suicide, I was much older. I was in the army and 22 years old when my friend hung himself in his garage. The thing that affected me most about this suicide is the fact that he had tried to reach out, but I hadn't noticed. There were also other small hints that in hindsight I could have picked up on. A few days before the incident, he asked if he could borrow some money off me, which I lent him. The next day, he came around with his girlfriend and gave me some suits that he said he didn't want. The night before the incident, he sent me a text message asking for help. It was late at the time and I asked what the problem was, but he didn't reply. The next day, his mother found him in the garage. This one hurt me for a while because I felt responsible. My mates told me that it wasn't my fault and that I couldn't have known, but I still felt guilt for a long time. We were in the army where hegemonic masculinity is very prevalent. Weakness is not accepted, and as I look back, I'm not surprised that my friends struggled to find help. I think that if there was a more supportive environment and more access to education, then this could have been prevented. Also, the community that he was surrounded in, or the army, didn't have support systems in place to combat depression. The most recent and painful experience occurred in 2013, a few months before I was due to leave the army. My mum called early in the morning to tell me that my brother had hung himself from a tree. He was only 21. I hadn't seen him for a while because I was busy with my career and we lived far apart. I was so angry at myself and at my brother because I felt that suicide was such a selfish thing. Dealing with a suicide in the family is a hard thing to do because everyone feels responsible. There is always a what if factor, and it plays in your mind. Most of all, it broke my heart to see my little sister, who was 15, trying to deal with the situation. Even as I say this, I still wouldn't know how to deal with the situation because I think the subject of mental health and suicide is foreign to most of us. Last year, the government cut $140 million worth of funding from the mental health budget. This is a backward step from the government, who have blatantly contradicted themselves regarding their commitment to the Ottawa Charter. The rising inequality, climbing suicide rate, and the lack of mental health care in New Zealand are all indicators that show the detachment of the policymakers towards people. The People's Mental Health Report, a crowd-funded initiative, was developed in response to last year's tax cuts. It recommends that the following steps be taken to prevent the negative statistics from getting worse. An urgent funding increase for mental health. Fully independent oversight of the mental health system. An independent inquiry into the mental health services in New Zealand. And a national education program. The fact that we have crowd-funded campaigns aimed at improving awareness and people taking decisive action about mental health is a sign that we are on the right track to improving the situation here in New Zealand. If referring to the action means, we can see that they are covering a variety of the initiatives identified, including building a healthy public policy, reorientating health services, strengthening community environments, and most importantly, developing personal skills through education. Even this video that I'm doing is a small but positive step in the right direction. Although it is harder to work from the ground up, this is where the action needs to take place, and through health promotion, issues like mental health can be addressed.
Don't you know, we're talking about a revolution. Sounds